Bismillah ar-Rahman ar-Rahim. My dear students of Ajman University, today we will cover the topic ophthalmic drug delivery. Ophthalmic means to the eyes or on the eyes. Okay. Why we are saying drug delivery and we are not saying dosage forms? Because here we are not talking about solutions or suspensions or ointments, etc. No, we are talking about the place where the drug will be placed, and that is on the eye. Uh, that's why you will notice later on that among the dosage forms used for ophthalmic drug delivery were already covered previously, and these include solutions, suspensions, ointments, gels. These were already covered previously. Uh, why then we are talking about ophthalmic drug delivery? Because this route of administration requires certain uh, provisions or certain condition for the preparation to be suitable for the delivery into the eyes. Okay, يعني not any solution or not any suspension can be administered into the eye. طيب, what are the outcomes? What you are supposed to learn or to be able to answer after the end of this topic? You are supposed to describe the ophthalmic drug delivery. What does it mean? What are the types of drug that can be administered into the eyes? What are the various pharmaceutical adjuvants in addition to the drug and the vehicle? What else can be there in the preparation? So, what are the adjuvants, materials that will qualify and help the product to do its work? Uh, at the end, we will be talking about contact lenses. So you need to differentiate between various types of contact lenses products. Is and products that are used for contact lenses. Yes, usually these contact lenses are prescribed or sold by ophthalmologists, but the products can be available in the pharmacy and you should be able to counsel about them. And you're supposed to recommend the appropriate care product for a given lens. Also, you are supposed to tell us or to tell me what are the proper administration steps. What are the steps that should be followed when someone is using a preparation for ophthalmic drug delivery? These are the things you will learn. These are the things you'll be able to do, inshallah, at the end of this topic. So, we will cover the whole topic in this session, inshallah. So, the first thing is what are the ophthalmic preparations? These we are talking about pharmaceutical preparations that are applied topically to the eye, on the surface of the eye, to treat a surface condition or maybe something inside, little bit inside, that is, we call it intraocular condition. If we want to study the eye and, for example, consider the tear in the eye. Now our eye is lubricated, there is tear in our eye that will allow our eyelids to, close and open. Now, what is this volume? This volume usually ranges from 7, okay, to 10 microliter. Microliter. 7 to 10 microliter. Now, if you want to convert this 7 to 10 microliter, it's like 0.007 to 0.01 ml. You see how small is this volume. Okay, that's why if you want to talk about administering a drop or a solution into the eye, then this will usually accommodate something between 5 to 10 microliter. That's very, very small amount. Imagine that if I am talking about a drop of water, a drop of solution, it's about 0.05 ml, okay, which is ish larger than everything I'm talking about here. Okay, is an one very important thing to talk about here is that the volume that can be accommodated on the eye is very small. Okay, and the administration or the eye can accommodate from 5 to 10 microliter of the ophthalmic preparation. Also, the absorption, if we are talking about the absorption is also very small. One reason, okay, we will talk about this maybe later, but one reason is that any solution that you are apply, okay, into the eyes, on the eye surface, will be drained through the lacrimal duct or tear duct, okay, that is on the inner corner of the eye. There is a duct, okay, and it goes to the nose and even to the mouth. Okay, there is the lacrimal duct, and whatever we apply as a liquid, it will not stay long there. Okay, see, this is the inner corner of the eye, and you have the lacrimal drainage in this area. Uh, that's why if I want my preparation to stay for a longer time, one of the things that we usually do is we increase the viscosity. Okay, we make the preparation more viscous, like gels. Okay, gelling agent, we make it viscous through formulations such as a gel system, liposomes, okay, polymeric carriers, uh, making the preparation as suspension rather than solution, ointment rather than liquid preparation. These things will prolong the residence time on the surface of the eye and will make the drainage more slowly. Okay, this is the eye. You need to know what we are talking about when you look at this figure. Now, for what purpose do we administer medication into the eyes? We may administer local anesthetics, okay, like tetracaine, cocaine, and proparacaine. Okay, these are employed maybe before operation, after operation, or maybe during examination of the eye. So these are the local anesthetic. We may apply antibiotic and antimicrobial agents to treat ophthalmic infection and combat ophthalmic infection. These antibiotics include azithromycin, gentamicin sulfate, sodium sulfacetamide, ciprofloxacin, ofloxacin, polymyxin B, bacitracin, and tobramycin. Okay, tobramycin is very famous also. Okay, that's why if you are having your training in community pharmacy, look at these ophthalmic preparations. Then antibiotics can be administered. We have also antifungal agents, okay, and these are used to treat against fungal endophthalmitis and fungal keratitis, and include amphotericin B, natamycin, and flucytosine. These are the antifungal agents, and we have anti-inflammatory agents in case of inflammation and redness of the eye, inflammation of the eye. So we may use steroidal drug like fluorometholone, okay, prednisolone, dexamethasone. These are steroidal anti-inflammatory drugs. And we have non-steroidal anti-inflammatory drugs such as diclofenac, florbiprofen, ketorolac, and soprophene. Okay, these are non-steroidal anti-inflammatory drugs. They are used to treat inflammation and allergic conjunctivitis. We also have antiviral agents in case of viral infection. These include trifluridine, ganciclovir. When you see clovir, it means antiviral. Vidarabine. These are antiviral agents and they are used to combat viral infection that can be caused by herpes simplex virus. Astringent, when you have also redness of the eye, zinc sulfate can be used, and otherwise we have also other agent. Okay, اللي هو vasoconstrictor can be used as well. We will talk about it later. But for the redness of the eye, we may use zinc sulfate as well. Uh, Beta adrenergic blocking agents, they are used to treat intraocular pressure. Okay, and when you have glaucoma or when the patient has glaucoma, can use such drugs like betaxolol, levobunolol, metoprolol, and timolol. Okay, these are among the agents. We have also myotics to cause constriction of pupil and to treat other glaucoma conditions such as pilocarpine, and for adrenergic agents we have abralaconidine hydrochloride, and as sympathomimetic we have dibiviferine hydrochloride. Okay, what are myotics used for? They are used to treat glaucoma and الحول, or we call it crossing of the eyes, or in English the term they use accommodative esotropia. And also in the condition where the muscles of the eye is weak, myanthenia gravis. We have also mydriatics and cycloplegics. Cycloplegics is the same as mydriatics, except that this is for longer acting drugs and they cause dilatation of the pupil. And what you need to do that for the purpose of examination, to examine the eye. The doctor may administer drugs like scopolamine, atropine, homatropine, etc. uh, Protectant and artificial tears, especially when the eyes are dry, and because of their dryness the patient might be itching the eyes and not feeling comfortable. In this case you can give artificial tears, which includes polymers like carboxymethylcellulose, methylcellulose, hydroxypropyl methylcellulose, polyvinyl alcohol. Also the hyaluronic acids, they are also used in this regard. Vasoconstriction, and if you remember the redness of the eye, we can use decongestants or vasoconstrictors that cause the constriction of blood vessels, and by doing so it reduces the redness in the eye. These include nafazoline, oxymetazoline, and tetrahydrozoline hydrochlorides. For antihistamine, that can be given in the case of allergy, okay, to relieve from itching or, that results from pollen, etc. and animal dander اللي هو صوف الanimal. Okay, you can take medication, or the patient can take medication such as imidaztine difumarate, ketotyphene fumarate, and olopatadine hydrochloride. Okay, so please familiarize yourself with these medications and try to memorize as much as you can. Now, regarding the requirements, because I told you that ophthalmic preparations will need to have some requirements. There are requirements in this preparation. It's not like simple solutions or any oral solution. The first thing, the requirement is sterility. This preparation must be sterile. Sterile, so you remember parenteral products, they also must be sterile. But the difference here is that the ophthalmic products do not need to be pyrogen free. Okay, so we don't do any testing for pyrogen here. Is and yes, they are sterile, but they don't need to be pyrogen free. And the method of choice will be, or let me say the following: autoclave or steam heat is the method that is more reliable than any other method that can be used with ophthalmic preparations, except that for filtration, okay, yes, it is less reliable than autoclave, but it has an advantage over steam sterilization. Okay, it has an advantage over steam sterilization in that it not only removes microorganism, but it will also remove dust fibers in the solution. And you know that removing of these debris or these materials is important in ophthalmic solutions. Okay, so this is the advantage if I'm using filtration for the purpose of removing microorganism and rendering the solution sterile. Another thing you need to add اللي هي preservatives. Okay, these are added except when you are dealing with single use containers. Okay, in such case you do not need to use preservative, because liquids that are used in large quantity as a single dose, these liquids are usually used to treat and manage traumatized eyes. Okay, so only large volume of liquid, ophthalmic liquid, is used when you want to wash the eye, when you want to bathe the eye. In that case you use large volume of liquid, and it has to be in a single use containers, because the presence or the availability of preservative in such a large volume and using them on the eye will cause irritation to an eye that is already irritated, and I don't want to irritate the eye, so I don't want to add preservative in such cases. Okay, so what are the kinds of preservatives that are available? We have benzalkonium chloride, okay, and you have taken this before in parenteral and also in emulsion. You have taken this benzalkonium chloride. We have benzethonium chloride as well, chlorobutanol, phenyl mercuric acetate, phenyl mercuric nitrite, and thiomerzal. Okay, this is an organomercuric compound. Now, what you need to pay attention to when you are using preservative is whether the preservative will be compatible with the preparation, whether it is stable in the pH, whether it's effective, etc., etc. I'll give you some examples where you have to take some precautions. For example, if you are using chlorobutanol, okay, if you are using chlorobutanol, you cannot use it in a preparation where you will subject this preparation to autoclaving or to steam heat, because high temperature, okay, not very high, even less than the steam temperature, will cause chlorobutanol to deteriorate and degrade into hydrochloric acid. Okay, and of course, This will cause the preparation to be ineffective as preservative, and also the hydrochloric acid will change the pH of the preparation, which is not good as well. Also, you have to take care when we are talking about some highly resistant microorganisms such as the gram-negative Pseudomonas aeruginosa. Now, these preservatives are not very effective against this microorganism. And in order to be able to preserve the preparation, you need to use, for example, benzalkonium chloride. In addition, you either use polymyxine B sulfate or disodium edetate or disodium ethylene diamine tetraacetate. Now, this disodium edetate is a chelating agent, and they found that when you are using disodium edetate in the ophthalmic preparation and there is a microorganism, this disodium edetate will chelate minerals like calcium, and it will cause benzalkonium chloride to be more effective on the microorganism, okay, or it will cause the microorganism to be more sensitive to benzalkonium chloride. Okay, so what I mean is you have certain precautions, okay, when you are considering the use of preservatives. Not only these things, but as I said, you need to consider solubility, compatibility, effectiveness at a given concentration, etc. Isotonicity, the same case with parenterals apply here. Okay, the same case is that your ophthalmic products need to be isotonic with the eyes. Now, for example, if we are talking about normal saline, to be isotonic with the eye, it's 0.9%, and that is isotonic. Now, equivalent to that, we need the ophthalmic preparation to be equivalent to about the 0.9% of sodium chloride. Okay, I'm not saying that the concentration of the drug should be 0.9%. I'm saying the tonicity, the equivalent tonicity should be about 0.9%. But they found that even if the equivalent in tonicity is ranging from 0.6 to 2%, there is no great discomfort to the eye. Yani the eye can still tolerate such preparation. Boric acid with a concentration of 1.9% is equivalent as that in tonicity to 0.9% sodium chloride. Isn't a concentration of boric acid with 1.9% has the same tonicity as 0.9% sodium chloride. Okay, and this is what I was talking about previously when I told you I need the preparation, my drug preparation for ophthalmic use to be close to tonicity of 0.9% sodium chloride. And if you remember my previous chapter or my previous topic in parenterals, we learned about the sodium chloride equivalent method, okay, to prepare isotonic solutions. Okay, so what else you need in ophthalmic product? You need to use maybe a buffering agent to adjust the pH. Now, there are different factors affecting what exactly the pH that we need to use, okay, in ophthalmic product. What is the optimum pH? Now, there are many factors affecting this choice, okay. Yes, the pH will be close to 7.4, but we may make it less or a little more than that for other reasons. Now, our eye, pH, the tears in our eye, has a pH of 7 7.4. And this means that whatever you apply needs to be close to this one. But this is not the only factor. Isn't? For the comfort of the eye, we need the preparation to be closer to 7.4, but there are other factors. For example, the stability of the formulation. The stability can be affected by pH. Also, the solubility of the drug. If I want the drug to be in solution and soluble, then the pH is a factor. The bioavailability, the absorption of the drug through the epithelium of the cornea. Okay, the bioavailability will be affected by the pH. The pH that favors the drug to be in the unionized form will allow for better bioavailability. Again, the pH that I adjust so that the drug is mainly available in the unionized form, because for the drug to solubilize, usually it dissociates, it ionizes. Okay, now for me, or for the drug to be highly bioavailable, I needed to have more of the unionized form as much as the formulation will allow. Okay, and another factor that I talked about previously, the preservatives will be more effective at certain range of pH. So I have to consider all these factors, and maybe I need to do some kind of compromise. Okay, I cannot fulfill all these requirements completely 100%, so I may need to do some kind of compromise. Among the vehicles used to adjust the pH اللي هو isotonic phosphate buffer. إذن it's isotonic and it's ايش buffer, and can be used to adjust the pH and even the tonicity of the ophthalmic preparation. Another requirement اللي هو viscosity or the thickening agents. And if you remember, we talked in the beginning that we need to increase the residence time on the eye. Okay, the residence time of the ophthalmic preparation, for it to stay on the eye surface for longer period of time, and for it not to drain through the tear duct quickly. So one of the ways to do that اللي هو to increase viscosity by adding thickening agents. For comparison purpose, you know that water has a viscosity of 1 centipoise at 20 degrees Celsius. Now, what is required for ophthalmic solutions? They found that the optimal range should be between 15 to 25 centipoise. Is in water 1 centipoise. What is required is 15 to 25 centipoise. What can we use? We can use thickening agents such as methyl cellulose, hydroxypropyl methyl cellulose, polyvinyl alcohol, etc. How can we measure the viscosity of Newtonian liquids? We can measure it using capillary tube viscometer. They call it Ostwald type viscometer to measure the viscosity. Okay, now we're going to talk about the bioavailability. Okay, now what can affect the bioavailability? Two things can affect the bioavailability. One, اللي هو physiological factors. Two, اللي هو to do with the formulation, اللي هو physicochemical characteristics of the drug and the formulation. Okay, طيب, what are these physicochemical characteristics? اللي هي ال pH, ionization of the drug, okay, viscosity. These are the formulation factors. What about the physiologic factors? Well, you need to consider the following. First, there are protein in the eye, Actually, tears contain from 0.6 to 2% of albumin and globulin. And drug can bind to these proteins. The drug, when you administer the drug may bind to these proteins. If the drug binds to the protein, the bound drug will not be available for absorption until the drug becomes free. Okay, so it can affect bioavailability. Another thing which can affect bioavailability اللي هو drug metabolism, because there are enzymes في التيرز such as lysozyme. And the third physiologic factors اللي هو lacrimal drainage. As I told you, مثلا بايلوكاربين after administering it to the eye, within 2 minutes all of this preparation on the eye will be removed by the lacrimal drainage, and only less than 1% of this bilocarbene will be absorbed. What are additional things? Well, you need to consider that for solution they must be sparking clear. And that's why, if you remember, we said that when we use filtration to remove microorganism, it's good because it can also remove other particles. What if I'm dealing with suspensions? If I'm dealing with suspension, then the suspended particles, they should be finely divided, and the recommendation is these particles should be less than 10 micrometer. Why not more? The reason is these particles will cause irritation to the eye. Okay, that's why they need to be very fine. Okay, what about the packaging? Here you see some of the packaging for ophthalmic product. The holding or the capacity of ophthalmic product can be 2, 2.5, 5, 10, 15, 30 ml. The plastic container, and this is the more common, has a fixed and built-in dropper. Yani when I open this one, the dropper is already built in within the top of the container. Okay, and this is preferable to the third type, where there is the glass bottle and separate glass or plastic dropper. So what you do, you open it, and then with the teeth bulb you press on it to withdraw the volume of liquid, and then you press on it again to release the drops. Okay, يعني it will be in the form of similar bottle like what you see here, and there is okay, this is the dropper. So what you do, you remove the whole thing. First you press on the rubber here, okay, to absorb liquid into the dropper, and then you open it, you take it out, you use it to release the drops, and then you put it back. Of course, this is not the preferred one. The preferred one is the one with built-in dropper, because this will reduce the likelihood of contamination, okay, contaminating the inner of the container. For some other containers, such as those that are used for eye wash, you will see that the bottle is a little bigger, okay, with an eye wash cap here. Okay, this is to wash and to bathe the eyes. Okay, we call it the eye cup. So how do we administer ophthalmic solutions and suspension? First, you need, of course, to wash your hands thoroughly. And when you wash it, you don't wash it with soap that is oily or something like that. No, normal soap. So you open it, and after that you tilt your head up, and then you see here, look up, and pull down the lower eyelid, and then dispense the prescribed number of drops into the eye here. After that, release this lower eyelid, okay, and keep your eye closed for 1 minute. During this time, press on this side of the eye, inner corner of the eye, in order to prevent the fluid from getting drained through the tear duct. Okay, this is the way you do it. Also, you need to advise the patient who's taking this medication, ophthalmic product, regarding the correct number of drops, the frequency, the duration of treatment, how to store it, and you should tell the patient about the usual side effects that they should expect. For example, stinging, irritation, crusting, all these are kind of side effects that the patient might experience. So he should not be surprised. What you see here is something important for you to look at. These are examples of drug and drug products and for what conditions they are used. So please look at them. And now we are going to talk about contact lenses, okay, and how to care for them. What are the solutions, pharmaceutical solutions, that are used to care for contact lenses? Well, there are three types of contact lenses, okay. One of them has been replaced, okay, is no longer there, but let me tell you the types. One is the hard contact lens, the second type is the soft, and the third type is the rigid gas permeable contact lenses, or simply gas permeable lenses, or oxygen permeable contact lenses. Now, this rigid gas permeable have replaced the hard contact lenses. So nowadays you don't get, or you don't see the hard lenses. Instead, you can see, instead of them, يعني to replace them, you have the rigid gas permeable lenses. So please have a look at this video where the ophthalmologist described the types of contact lenses.
I'm Dr. Ed Weaver with Wilmington Optometry in Wilmington, North Carolina, on behalf of Expert Village to tell you how to care for your contact lenses. Contact lenses are basically categorized in two categories: soft lenses and hard lenses. The hard lenses now are gas permeable hard lenses. They're not like the old hard lenses of 20 or 30 years ago. The gas permeable hard lenses are rigid lenses. They're made out of rigid plastic. And they offer good, effective vision correction, but the comfort of gas permeable hard lenses is not as good as a soft lens. Soft lenses are broken down into a conventional soft lens, which is a non-disposable soft lens, and disposable soft lenses. Disposable soft lenses are usually a 2-week lens, although there are different types. Soft lenses are made out of a soft hydrogel material, which is basically plastic material that is impregnated with about between 35 and 55% water. Good comfort, good vision. 95% of all contact lens wearers now wear soft lenses.
So as you see, we said that there are three types of contact lenses, but in reality there are two, because one of them replaced the other. The rigid gas permeable replaced the hard contact lenses. Most of the contact lenses wearers, they are wearer of soft contact lenses. Okay. Now, what about the soft contact lenses? Why they are popular? What else are they called? They are called also hydrogel lenses, and the reason for that, they contain considerable amount of water, okay, 30% to 80%, and this will enhance the permeability of oxygen because your eye cells or the epithelium cells need to breathe in your eye. What they are made of? They are made of hydrophilic transparent plastic, that is hydroxyethyl methacrylate, with a cross-linking agent to provide the hydrogel network. Okay. طيب, why they are popular? One of the reasons why they are popular compared to rigid gas permeable lenses or hard lenses is that they are soft, okay, and it's more comfortable to wear compared to the rigid gas permeable lenses. Now, you can classify these lenses in different ways. For example, you can classify them to daily wear and extended wear. What's the difference between daily wear or extended wear? Uh, Daily wear means you remove them at bedtime. Okay, that's what is meant by daily wear. Extended wear means you wear them for more than 24 hours. Okay, some of them has been approved for 30 continuous days. Okay, that is the extended. So this is one way of classification. Another way of classification اللي هو whether it's disposable or not. طبعا all soft lenses must be at the end must be replaced, yes. But when we call a lens a soft lens, okay, when we call a lens disposable, it means you don't need to care for them. يعني there is no solution to care for them. You take them, you wear them, and when the period is done, whether it's 1 day or more, then you throw them and you wear another contact lenses. Okay, that's the disposable soft lenses. Isn't no need for caring solution because they are used once, whether this once means 1 day or more. Okay. طيب. Now, one of the good things about these soft lenses, not only they are comfortable to wear, but they have larger diameter than the rigid gas permeable lenses, that is 13 to 15, and this is why they cover the entire cornea. Now, what is the advantage of this? إنه هو it's less likely to dislodge from the eye, unlike the hard lenses or rigid gas permeable lenses. Also, because it covers most of the cornea, there is less likely for foreign particles to get inside or between the lens and the eye. What about the disadvantages? The first disadvantage اللي هو visual acuity, okay, which talks about how sharp your vision will be after that. Well, the rigid gas permeable is better in this regard. يعني to correct vision, okay, and for the vision to be crispy clear and sharp vision, no, the rigid gas permeable is better. Also, another disadvantage اللي هو it's less durable. Okay. Third disadvantage اللي هو absorption, possibility of absorption of medication. Okay. And another thing that you should also need to take care of اللي هو you don't want the lenses to dry out, because if they dry out you need to dispose them. Okay. According to FDA, they define disposable, the term disposable meaning what? Okay, it means they can be either worn for a single day, or if they are extended lenses for up to 7 days. This is according to FDA. Okay, يعني it can be daily or it can be extended depending on the wear schedule prescribed by the eye care professional. Any lens that is intended to be removed from the eye cleaned, rinsed, disinfected, reinserted does not qualify for inclusion in this category under the FDA definition. يعني what is meant, if you are going to remove the contact lenses, clean it, wash it, that's what you are supposed to do, and then insert it again, maybe later, then that is not disposable lens. Okay, the second type of lenses اللي هو rigid gas permeable lenses. They are similar to hard lenses, but they are more flexible by the incorporation of silicone, which not only make them more flexible, okay, compared to polymethyl methacrylate for hard lenses. Not only that, but will allow them to be oxygen permeable. Okay, this is something good. The advantages انه they allow oxygen to move through the lens, and this is better than the old hard lenses, while retaining durability. They are durable like the hard lenses. The hard lenses, they were used sometimes for 1 year, 2 years, so they are durable. And ease of handling. Handling soft lenses is not easy, okay, because they are soft and very, very flexible, okay, but it's easier to handle the rigid gas permeable lenses. And the regimens or the solution to take care of these rigid gas permeable lenses are simpler, okay, and they are more resistant to absorption of medication, and visual acuity is better than the soft contact lenses. Okay, what about the disadvantages? Because their diameter is small, they are more easily dislodged. Okay, this is one disadvantage. Another disadvantage is because of their rigidity, they are less comfortable for the wearer or for the patient or for the customer to wear, and requires more adjustment period until the customer gets used to wearing them. Okay, you see here also the diameter is smaller, that's why they can dislodge easy. Also, they are available as daily wear and as extended wear rigid gas permeable lenses. Okay, now we're gonna talk about how to take care of lenses. Now, the solutions and the preparations that we have for soft contact lenses are not the same. يعني I cannot mix between the solutions for different types of lenses. I cannot mix between them. For soft lenses, not the disposable one, okay? For the soft lenses, not the disposable one, you need solution to clean and loosen the lipid and the protein deposits on the soft lens. You want to loosen them. Then you want to rinse them. Rinse them to remove these loosened lipid and proteins. Okay, and you want to disinfect them to kill any microorganism. That's what you need for soft contact lenses. Now, for cleaning purpose and to remove lipids and protein, we may use surfactant, which will emulsify accumulated oils, lipids, and occasionally, less frequently, you may use enzymatic cleaners. Okay, this is less frequently. Okay, for example, containing subtilizine A enzyme, low protease enzyme. You may use it to remove protein deposits. Okay, we have a solution containing 3% hydrogen peroxide. 3% hydrogen peroxide can be used as disinfectant. Okay, and it combines enzyme for cleaning and disinfection in the product called ultrazyme enzymatic cleaner. هذا الالترازايم enzymatic cleaner okay, will have this enzyme, and you can dissolve the tablet in a vehicle containing hydrogen peroxide for cleaning and disinfecting. Isn't cleaner, when I say cleaning, remember surfactant is very important. Rinsing, for rinsing and storage as well, because if you remember, soft contact lenses should not be dry. It should always be in a solution. So the rinsing and storage solution is usually saline solution. It's saline solution, and the pH is usually neutral. We need to maintain the curvature of the lenses and its optical property, and prevent them from becoming dry and brittle. Okay. For disinfection, we either disinfect thermally, يعني put it for 10 minutes in a water with temperature of a minimum of 80 degrees Celsius, or chemically using hydrogen peroxide, and this is the more popular way. But after that, you need to neutralize or remove any hydrogen peroxide so that it doesn't irritate the eyes. For rigid gas permeable contact lenses, you need also cleaning solution to remove debris and deposits. You need soaking and storage and disinfecting solution when you are not using it. And here you need a wetting solution, because rigid gas permeable lenses, although they are, or they allow oxygen to pass through, they are hydrophobic, very hydrophobic. And adding a wetting agent will allow the wearer to feel more comfortable, because one of the problem of rigid gas permeable lenses is that the customer will not feel comfortable wearing them, not like soft lenses. Okay. And for the customer to get used to the contact lenses faster, you need to use wetting agent before adding, or before applying, or before fitting the rigid gas permeable lens. Cleaner, there should be surfactant to remove the deposits from the surfaces of lenses. Soaking and storage solution. For storage, you need disinfecting agent such as benzalkonium chloride, and if you remember, for Pseudomonas aeruginosa, you will need editate sodium to kill bacteria. And for wetting agent, again, you need surfactant to facilitate the hydration of the hydrophobic lens surface to enable the tears to spread evenly on the lens. That's what you need. Combination solutions. Customers, they like, why do we have so many solutions? For each thing we have a solution. We need one solution for everything. Well, commercially these are available, but they are less efficient than individual solution. Okay, when you put them together, uh, uh, all the steps will be less efficient. Okay, these are examples, okay, of contact lenses solutions. Now, what are the clinical consideration? يعني what can happen, what you should warn the patient or anticipate if there is any problem, anticipate or expect the reason. طيب, one thing, can you apply ophthalmic suspension or ointments while wearing contact lenses? No, it will be difficult. Okay, how can you apply the medication or ointments and you want to wear contact lenses? So this is considered as difficulty. Also, it's possible that the customer might notice discoloration of the contact lenses, for example, to orange color if they are taking a medication called rifampicin, because this medication, among the systemic effect of these medications is that because they are systemic effects, so they are in the blood, they go to the eyes, and the color might go to the lens. Okay, or from aerosolized ribavirin. Ribavirin is antiviral. From aerosolized ribavirin, okay, while wearing contact lenses, might cause lens clouding. Okay, so when you look at the lens, okay, through the lens in the eyes, you feel that there are clouds. Also, drug that has anticholinergic effects زي ايش, like what, antihistamines, tricyclic antidepressants. These drugs, they decrease tear secretion. Okay, so your eyes are drier, and this may cause lens intolerance and even damage to the eye, because remember that soft contact lenses, they need to be ish wet. Opposite to these, okay, if you have drugs that may promote excessive lacrimation, yani more tears to be secreted, or drugs that can cause edema in the eye, eyelid edema, زي hydrochlorothiazide, these drugs will also cause or interfere with wearing the lens. Okay, what are the guidelines that the pharmacist should tell the patients about contact lenses? So, how do you counsel? Well, the first thing is wash your hand, of course, before and after handling the. Now, I'm talking about contact lenses. Before and after handling the lenses, wash them. Do not rub your eyes, especially when the lenses are in place. Use only care products specifically recommended for the contact lens. Don't, okay, some customers, they don't want to spend money, so they say, well, we'll use tap water. So the customer should not store the lenses in tap water, or maybe use the saliva when they want to insert the lens into their eye. And saliva can contain Pseudomonas aeruginosa, which is very dangerous. During cleaning, okay, check if the lens has any scratch, any chips, any discoloration, and avoid what we call left lens syndrome. Okay, what happens usually when the customer takes the lens? Okay, first they take the right lens, okay, and then they want to clean it, so they cleaning it very efficiently. Okay, remember, don't clean like that circular, it's wrong. It should be up and down like that. Okay, so they take the right, they clean it, they are very enthusiastic, and then when they go for the left one, they are like tired and lost interest, so they may not clean it well. This will end up with what we call left lens syndrome, where the customer will see through the right one better than the left. So you have to clean the left one as good as you clean the right one. The patient or the customer should also avoid using mascara and eyeshadow, pearlized eyeshadow, if they are going to wear lenses, because the particles from the mascara and the eyeshadow might get into the lenses or between lenses and eye and cause irritation. Also, if you have to use aerosol hairspray, then you should do it before the lenses are inserted, and preferably do that in another room, not in the same room where you are going to wear the lenses. Why? Because if you apply it in the same room and then you are going to wear the lenses, there are some aerosol will stay on in the air. Okay, some of the aerosols will be in the air for some time before settling down. Okay, they do not. The aerosol does do not settle down quickly. Also, if you are going to apply for the girls, طبعا, they are going to apply makeup, then it's better that you insert or remove the lenses before makeup. Whether you want to remove the lenses or you want to apply the lenses, then apply them, then you can apply the makeup. The reason is, if you put makeup first, your fingertips will be smudged with the oily things, with the makeup, and this can affect the lenses. If the patient is having pain, okay, طبعا on the eyes or in the eyes, this may be because the lenses are not good, or maybe there is corneal abrasion, or maybe other medical condition, and in this case the patient should be advised to consult uh, the ophthalmologist. Also, it's better that the customer regularly examine his eyes with ophthalmologist in order to make sure that everything is fine. Thank you very much. I hope you enjoyed today's lecture. And as always, if you have any question, please let me know. Bye bye.